if you have a patient that's ER negative, PR positive, I think the first thing that you need to do is go back to your pathologist and see if there's a technical error or not. So that's
Yeah,
really important. And they are a very small group of patients that are ER negative, PR
yeah,
positive, and you can't ignore them. You still have to treat them, but it's not the same as being ER
yeah,
positive.
yeah,
So I think it's very important, especially for those junior members out there, and those in trainee, that if you get a patient that's ER negative, PR positive, go back to your pathologist. There might be a technical error that you need to correct.
And the ER positivity is that score of 3 out of 8 that you get and above, or would you like to? Obviously, you'd like to see it higher, but I mean, is a 3/8 an effective thing to do? I think.
If if you look at the latest guidelines, both from St. Gallen and other international guidelines as well, they all state the same thing: 1% and above, treat
yeah,
them with adjuvant endocrine therapy.
yeah,
However, I think the confusion is going to come in those patients with low ER positivity, like you said, where they
yeah,
typically behave like a triple neg.
yeah,
And then you wonder whether you need to give them adjuvant immunotherapy rather than adjuvant endocrine therapy. And those are the patients that you really need to discuss in your MDT, because you're never going to have a clinical trial that's going to address them. We have two large retrospective studies, from one from Germany, one from Italy, that's actually shown that those patients with low ER positivity, they behave like triple negative breast cancer. So I think each of those patients, their treatment modality has to be individualized.